Delirium, or acute confusion. So what is delirium? If there's a sudden change in your loved one's mental state, it could be delirium. Delirium leads to increased confusion, disorientation, difficulty with concentration, and it can come on very quickly. So it can come on in a matter of hours. Always be suspicious if your loved one changes quite dramatically within hours. It can occur when you are medically unwell and can be caused by infections, pain, dehydration, or constipation. Delirium can significantly affect how someone behaves and functions, especially if they have dementia. And it can be very distressing for the person with dementia and the people caring for them. It's quite often misdiagnosed or underdiagnosed, and it can be put down to your loved one's dementia when it's actually not. It's a delirium. So delirium is a treatable condition, and as previously mentioned, it may coexist with dementia. And its official name is delirium superimposed on dementia. So it's delirium on top of dementia. It is not the dementia, it is a delirium. Unfortunately, it's sometimes difficult to recognise in people with dementia because it has similar conditions such as confusion and difficulties with thinking and concentration. People with dementia are 5 times more likely to get a delirium, so please be aware of that. It can last for a few days, weeks, months, but it may take longer for people with dementia to recover. And in hospitals especially, approximately 20 to 30% of older people on medical wards will have a delirium, and up to 50% of people in hospital wards with dementia. It's very common following surgery, especially hip surgery. It's very common in intensive care also. So older people with delirium and dementia have been found to have longer stays in hospital and be at increased risks of complications such as falls, accidents or pressure sores, and more likely following discharge to be admitted into long-term care. In extreme cases, delirium can be fatal, so it is vital that the person receives treatment as soon as possible. The symptoms of delirium. Well, there are 2 types of delirium. There's hyperactive delirium, and people get more confused. This can fluctuate throughout the day. They can be very agitated and restless. They can hallucinate more and be quite preoccupied with their hallucinations. There's another type called hypoactive delirium, and people will be much more drowsy, less responsive, much quieter than usual. And you can have both these types together, and that's classed as a mixed delirium, and this is the most common type of delirium when you've got hyperactive and hypoactive symptoms. So as previously mentioned, delirium can include seeing things that are not there, hallucinations, or having vivid dreams that are worse at night. The person may struggle with attention and problems with following a conversation, and it can be very frightening for people. So people who have had delirium, they say that they felt unsure of their whereabouts, they were worried people were trying to harm them, they felt afraid, irritable, anxious, depressed. And then if they had the hypoactive delirium, they felt slow, they felt sleepy, or they may have felt agitated and restless if they had the hyperactive delirium. They had vivid dreams that continued when they woke up, and they found it hard to follow what was being said. They found it difficult to speak clearly, and they saw and they heard things that weren't there. So who's more at risk of delirium? Well, as mentioned before, people with dementia are 5 times more likely to get a delirium. People who are dehydrated or haven't eaten a lot, because we do get fluid through our diet as well. People with an infection, and just be aware that low-level infection may not show up on tests. Urine infections are quite common to cause delirium, chest infections. People who are constipated or have urinary retention, so they can't pass urine. people who've had surgery, particularly hip surgery, multiple medications. So if somebody's just started a new medication and they become more confused, that could be a delirium. Or people that are on a lot of medications can trigger delirium. If people can't see properly or hear properly, that can cause a delirium, so make sure they've got the glasses and hearing aid to hand. People who are nearing their end of life, so especially the hypoactive delirium where people are more sleepy and drowsy. People who are in pain, pain is a big trigger for delirium. People who are in unfamiliar and distressing environments, so they may have been admitted to hospital. And age is the biggest risk factor for delirium. So what should I do as a family carer if I suspect delirium? Contact the doctor's GP for an urgent assessment and advice, and tell the receptionist that your loved one's got dementia but they're showing signs of delirium and you need an urgent consultation. How is delirium treated? Well, the doctor may request blood or urine tests to decide upon the appropriate treatment, so they're going to be looking to treat the cause. They may want to review any medication that may be contributing to the delirium. So if a new medication's been started, they may need to stop that. Delirium can be prevented by targeting potential causes such as constipation, dehydration, and infection. If your loved one is in hospital, you want to try to avoid the moving beds or wards because that can increase the confusion. So what can I do as a carer to help somebody with delirium? Well, I think the first thing is to try and keep you calm yourself and try to reassure that person. Use short, simple sentences when talking. Be aware of your pace, slow your pace. New slide, please. Observe the person to see if they're in any pain. So look for grimacing, look for guarding, look for signs of and sounds of distress. Look for flushing, look for pallor. Make sure there's nothing obscuring their senses and have their glasses and hearing aid to hand if they use them. Use familiar photos and objects to distract the person and provide familiarity. If your loved one's in hospital, you may want to leave some photos and anything that's comforting for them. Help ground the person by making sure they know the time and the date. Help the person to find the toilet if needed. Avoid too much stimulation and having too many people around if possible. Very bright lights or loud noises can be agitating for a person with dementia, and conversations can be very difficult for somebody with dementia if several people are talking at once. Ensure that there's a night light on so that there aren't any accidents with falls if somebody gets up for the toilet. Shadows can look distressing for somebody with a delirium. And avoid disagreeing with the person too much. Change the subject if they express ideas that seem odd to you. Offer drinks to maintain hydration. And offer a variety of drinks as well. So thank you for listening to this Delirium podcast. I hope it's been useful. Again, my number's here on screen if anybody needs to talk to me about anything. There's the Admiral Nurse Helpline as well that you can always phone them if you're concerned about a delirium or anything else. And for ex-veterans, there's the Royal British Legion Admiral Nursing Service that you can self-refer to.